Okay, thanks. Whoops. Thank you very much. That was actually really interesting for me to hear about, because the majority of my talk is going to be actually about how we do want to decrease our length of stay. That's a really big focus in the United States, maybe less so because of the patients, but definitely more so because of our hospital administration and regulatory bodies. So it's going to be a lot different focus. And I have no disclosures. So just briefly, for those who don't know what an enhanced recovery program is, it's basically an evidence-based, multimodal, integrated consensus on perioperative care. It's designed to reduce physiologic stress, support early function, improve outcomes, and decrease unwanted variability in the perioperative period. And really, the whole concept of enhanced recovery programs is because we want to try to reduce stress, and surgery is stressful on the patient. Of course, it causes pain, it causes immune dysfunction, cardiac and respiratory dysfunction, so it is a stressful thing. And so all the elements of enhanced recovery programs are designed to reduce that. So that might include things like using minimally invasive surgery, using things like epidurals or spinals to block neural blockade, pharmacological interventions such as multimodal analgesia, antiemetics, et cetera, and then other interventions such as maintaining normothermia and balanced fluids in the operating room, et cetera. I would say that there are a lot of enhanced recovery programs that are used in the United States. They all basically have the same elements, the preoperative, intraoperative, and postoperative elements, but each enhanced recovery program is sort of procedure specific, so that all the different elements might be a little bit different depending on what the procedure is. And then these are just the sort of basic elements that we follow. This paper was by Dr. Khaled. He's a surgeon in Denmark, and this is probably considered the landmark paper for enhanced recovery programs. Basically what this group did is they had 60 patients who had traditional open colon surgery. At the time, the average length of stay for an open colon resection was anywhere between 6 to 12 days. This group implemented sort of the first enhanced recovery program for those patients, and they were able to get the length of stay down to a median of 2 days with only a 15% readmission rate. And that utilized many of the elements that we're going to be talking about here today. So that was sort of this is sort of the, I would say, landmark paper that most enhanced recovery programs are based off of. And since that paper, we now have multiple enhanced recovery programs. These are all ERPs that are based on evidence. They're for all different kinds of surgeries. They all sort of have sort of the main elements in common. Most of the recommendations that are made for the different types of enhanced recovery programs are based on what we call strong recommendations. There's a lot of stakeholders involved in these programs, and most of the elements that we're talking about don't actually involve the surgery itself, but all of the things that surround the surgery. And I'm just going to go over a few sort of studies that were done in North America that sort of go over and show what enhanced recovery programs have been able to accomplish. This is a study that was done by Dr. Leanne Feldman, who's probably one of the best-known enhanced recovery experts in North America. She's based in Montreal. This study basically was a multi-institutional study. They had 2 university-affiliated hospitals. They implemented an enhanced recovery program for colorectal surgery at one university hospital, and at the other facility, they didn't use the enhanced recovery program. And basically, they just looked at the patients, and you can just see here that for all of the outcomes that they measured, all of the patients in the enhanced recovery program did much better, including the median hospital stay, which was decreased significantly. What was really interesting about this study, though, is that in addition to the fact that the patients had improved perioperative short-term outcomes, they were actually also able to show that the patient themselves lost less work days, so they were able to get back to work quicker. Their caretakers also lost less work days because they didn't have to take care of their patients as much, and there was less need for home health visits. So essentially, this showed that not only was there improvement in sort of the traditional outcomes that we are used to looking at for enhanced recovery programs, but you also were having sort of a greater effect. And additionally, they were actually able to show that the enhanced recovery program patients saved the institution money, saved the healthcare system, and actually they extrapolated that to societal cost savings. So this was a pretty interesting study, again, showing that in addition to just the traditional outcomes that we're looking at for patients, this is also advantageous from a much greater viewpoint. This is another study. This is from Johns Hopkins. This, again, looked at an enhanced recovery program, but again, in addition to implementing the advanced recovery program, what this group did was actually utilize what's called a comprehensive unit-based program, or CUSP, and basically what that does is looking at a way to not only implement the enhanced recovery program, but also to get everybody that's involved in the program sort of on board, so to affect an organizational change, culture change. And that involved this, what they called an accountability model. So that means that they had to get buy-in from everyone, from the senior hospital leadership all the way down to the frontline staff. Everyone was invested in this program being successful. Everyone was, in addition to the patient's outcomes, they also wanted to measure the satisfaction of actually the healthcare providers in implementing the program. And again, as you would expect, after the implementation of the program, there was a reduction in the sort of traditional outcomes like surgical site infections, urinary tract infections, venous thrombotic events. But in addition, again, there was an increased patient satisfaction, increased satisfaction on part of the healthcare providers, and of course, decreased length of stay and cost savings. And then this is just one last study. Again, I'm just giving these as examples to show how the enhanced recovery programs that have been used here in North America can, again, not only improve patient outcomes, but improve broader outcomes. Again, this is also a colorectal study, pre and post enhanced recovery implementation. And what you see here in the graph is that the light blue bar are the patients in the advanced recovery program compared to the dark blue bar. There's a shift towards the left for length of stay. But what this study was unique in doing is that not only did they compare their outcomes to the pre and post patients, but they also compare their outcomes to expected length of stay using the NSQIP database. And even and so that was comparison looking at that nationwide. Again, they were able to show really improvement in those outcomes as well. Again, not surprising, the gold bar is the mean hospital stay for all the patients in the hospital. The dark blue line is pre and post implementation for those patients. So I would say in the United States, we've been a little bit behind compared to our European groups that, there's a program, there's a group called ERAS, that's their actual name, that's a European-based group. They've actually been much more innovative as regards to implementation of enhanced recovery programs. Here in the United States, we're now finally catching up. Traditionally, there's been a lot of focus on colorectal surgery. That's now becoming leaching over into other procedures, but we do have American Society for Enhanced Recovery, which is ACER. There's also some anesthesia societies that are looking into enhanced recovery programs. All of these basically now starting to publish recommendations on enhanced recovery programs and how those can improve outcomes for our patients. So I feel like we're finally getting along as compared to the European groups. And then finally, I'm just going to end with briefly just showing you some one of the most recent enhanced recovery programs that's being used in the United States right now. This program is called Energy. It's employing new enhanced recovery goals for bariatric surgery. This is being supported by the MBSA QIP and the American College of Surgeons. It just got implemented less than a month ago. Our institution, University of Wisconsin, is one of the groups that are being used. Again, it utilizes all of the main components of enhanced recovery programs that you would expect. I think there's a lot more focus on really minimizing the use of opioids, as that seems to be a big focus in the United States right now. The other thing that's a little bit unique for this program is that there's the utilization of a patient assessment tool that's used pre-op, post-op. Also, there's a lot of focus on making sure the patients get all their visits scheduled before they leave the hospital, get all their prescriptions filled before they leave their hospital. So it's sort of, again, a little bit more tailored towards bariatric surgery patients. And then here's just a list of all the patients that are currently being participating in this protocol. So that includes ourselves, it includes Cleveland Clinic, Duke, Mount Sinai, New York. So there's a lot of well-known hospitals that are all participating. Just so you know, all the centers here that are participating in this program were identified because they were noted to be high outliers for length of stay for bariatric surgery. So we were identified by the MBS QIP to say, hey, we've noticed that your length of stay is longer than others. Let's see if we can use this enhanced recovery program to improve your outcomes. So our institution, we have two centers that do bariatric surgery under the same umbrella. We have 4 surgeons that do our procedures. We have a full comprehensive center of excellence for both centers. We have 2 full-time health psychologists, dietitians, PAs, nurses, MAs, everything that you would expect for a full center of excellence. And again, as I said, we were identified to be a high outlier for length of stay and readmissions, so we were approached by MBSI-QIP to implement this program. And again, the goal of this program is not only to reduce the readmissions and length of stay, but to have patients be more satisfied, and also with a big focus on trying to minimize narcotic use. Again, all the elements we talked about, those are ones that we're utilizing to try to improve this. Again, just as I talked about, making sure that patients are getting better pain control without using opioids, make sure they're getting their prescriptions before they go home, taking care of their visits before they leave, and then really using this patient assessment tool pre and post-op so we can see how patients are doing. Takes a lot of work to try to implement this into the hospital. So for example, we had to get the anesthesiologist to really be on board to get standardized protocols for the bariatric surgery patients. We had to really rediscuss how we were going to take care of our post-op patients with the nursing staff, because they're, of course, used to just getting a phone call if someone's having pain, that they would give them, narcotics, or we're trying to shift away from that. Had to talk to the pharmacy about allowing us to be able to use IV Tylenol and some of the other medications that are not necessarily used regularly, and then, of course, get to buy-in from the administrative leadership. What's that? Oh, okay. Sorry, I'm almost done. Yeah. All right. In any case, what we noticed when we did this is that we've already actually have most of the pieces of the protocol in place. And this is just an example of what the monthly audit report is. So they send you an audit report. They show, okay, here are all the surgeries you did. This is how you did it for all the elements of the enhanced recovery protocol. Then it goes back to MBSI-QIP, and then you get feedback at the end so that it's on a constant basis, so that you can see where you need to work and try to make your improvements as you go along. So that's, like I said, this is a relatively new program, less than a month implemented at University of Wisconsin and those other centers that I said. So I'm looking forward to see how that translates long term. So in conclusion, as you can see, advanced recovery programs definitely there's a lot of evidence that show that it can improve outcomes that are important here in North America. A lot of the outcomes that we're looking up, some of them are easily measurable, some not so much. So as more data becomes available, I would expect that more and more hospitals for different kinds of procedures will start to adopt these programs. Thank you.